Are you suffering from heartburn or pain right here, pain here, chronic sore throat, chronic cough that won't go away, that nighttime cough? It could be gastric reflux. My name is Marcia Roy Madison. I'm a family nurse practitioner, and I'm going to explain to you why you get those symptoms. This is your liver. Here's your gallbladder. Here's your stomach. And again, this is an oversimplification. When I'm explaining, I want a 10-year-old to be able to understand what I'm saying. So here's the gastrointestinal system. Now, the liver puts out an acid called bile. Bile is an acid. And when I say the word acid, that sounds like something that's irritating, right? An irritant. Okay, so this bile is an irritant. Mother Nature gave you this bile to break down fat, like dishwashing liquid. So if I were to fill up a sink with water and I poured oil in the water, the oil will sit on the top, right? If I take the dishwashing liquid and I put it into the sink with the oil, it's gonna break up the oil into small globules or small particles. That's what bile does. Bile breaks up the fat in the diet. The gallbladder catches the bile because you don't want this bile dripping into the intestines like a leaking faucet. So the gallbladder is the reservoir to catch the bile, but the liver is constantly making the bile 24 hours a day, 7 days a week. From the time you were born to the time you leave this planet, you will be making bile to break down the fat. The issue is that Mother Nature thought that the fat that you would eat would come from avocados, maybe some walnuts, maybe some olives every now and then. She had no idea that you were going to be eating barbecue chicken and chicken nuggets or any other foods that are high in fat. The other acid is hydrochloric acid. This acid is necessary to break down protein. Okay. Now we know that plants have protein, but what we tend to consume more of is the animal protein. So here's another acid that's going into the stomach. And then over time, when you're eating these foods 3 times a day, all of this acid starts to cause the heartburn. And the reason why we call it heartburn is because the heart is right here. Okay, so the heart is right there, and so that's why they say it's heartburn, because the heart is located right where the esophagus goes up. Now, over time, we give you the medication. The medication will coat the lining. I'm not going to say what the name of the medication is. It's a proton pump inhibitor. It's like an acid blocker. It will coat the stomach so that the acid doesn't feel so bad, and you just keep eating these foods and eating these foods and eating these foods, and damage starts to happen from the acid because that pill is masking what's going on. Then we send you to an endocrinologist, not an endocrinologist, a gastroenterologist or a GI doctor. They'll go down with a camera to see what's going on, to see how much damage is done. But at the end of all of this testing and cameras, nothing has changed. You still have to get these high-fat foods out of the diet because these foods don't take a lot of acid, but these foods do. So this is where it comes from. If you continue if this damage continues, I've had patients that's been on these proton pump inhibitors and these H2 blockers. Those are the meds I can't go into the names of the meds, but these are the meds that people are on all the time. I've had people that stay on these medications for 10, 15 years, and you can develop stomach cancer. Not necessarily from the medication, but just from the constant damage the cells of the stomach begin to mutate. Mutation means they change their shape, they change their form. And this is how stomach cancer can develop, of constantly damaging the lining of the stomach with all of this acid. So not everyone is going to have these symptoms. Some people may have like the colon symptoms from eating these animal proteins. So they may develop the constipation because these foods have no fiber. But I just really wanted to focus on where the heartburn comes from so you can understand why you're having the sore throat, as that acid is coming up, irritating the throat, why you're having the cough. Sometimes the acid will spill over into the lungs. So the lungs are back here. All right, so that explains the cough, the sore throat, and the heartburn. I hope that helps.